So I'm excited to introduce Karen Frederickson Comer, who's the Associate Director and Director of Collaborative Research and Community Health Informatics at the Polis Center. So Karen fosters research partnerships and community collaborations to advance the application of community and geographic information to the analysis of local, state, and national health issues. So she's got a really interesting background. I was excited to see this. So a background in landscape architecture and also currently working on a PhD from Fairbanks in public health and health policy and management with a population health analytics minor. So welcome. We're excited to hear more from you. Thanks for being here.
Well, thank you very much, Rachel, for inviting me to present. And this is a great opportunity to connect with the Regenstrief community. Polis wholeheartedly agrees with the suggestion that there are several important areas of alignment between the vision and mission of Regenstrief, which I know you just went through the strategic planning, and the vision and mission of the Polis Center. Polis is currently going through its own 5-year strategic planning process. And even though we're still in the middle of that process, I can safely say that building local capacity to explore the social determinants of health will be one of the goals over the next 5 years. And just as a heads up, I've got a 1 o'clock meeting right after this. So I am limiting my presentation to 20 minutes so we can still have time for questions and answers. But I think it'll be enough to get folks informed and excited about the opportunities to partner with the Polis Center. So first, a little bit about the Polis Center. We're applied research center at IU. We were founded in 1989 to serve as a bridge between the university and the community. We joined the IU School of Informatics, Computing, and Engineering in 2021. And this is just providing us really incredible opportunities to increase the speed of our innovation and to make a bigger impact on our community. So our initial home with the School of Liberal Arts, which was an amazing place to begin with all of the social sciences connections we made there. And those social science connections have followed us to the Luddy School. But now we've got the wonderful informatics environment and expertise to help us fulfill our vision and mission. So our mission is to work with community and academic partners to understand and actively improve community health, well-being, and resiliency. And we do this by making data and research actionable for improving community health, equity, and resilience. To do this, we build information technology and geographically precise data across a whole variety of domains and sectors to identify and address our community's most pressing challenges. So we are a convener and a connector and a collaborator, collaborating with both community and academic partners. And one of, again, to translate data and research into action. So we are focused on building the capacity of nonprofits, community-based organizations, government, and researchers to use information resources effectively for community good. So our primary and these are just some of our primary partners, again, include researchers, community-based organizations, human service providers, healthcare providers, public health organizations, and multiple levels of government. So we work all over the world. Not everyone realizes this because most of our work, as you can see in this map, is focused in Indiana. So you see all the red there. But we have projects across the country and also internationally. But we like to think of Indiana as our sandbox. And just the work that we do here, we like to consider it a model. We hope it serves as a model nationally and internationally for how to do community engaged research and really build strong relationships at the local level to understand concerns and issues, and to bring data, information, and academic expertise to the table. And I'll just add, I know I'm jumping ahead here, but we have recently joined a collaboration that's being led by our campus with university in India. We've already made one trip and we'll be going again. And Dr. Sue Babich with the Fairbanks School will be on that trip as well. But they're doing living labs at the university in India, and really figuring out how to embed themselves in the community to understand community needs and interests and challenges. And so we're going to learn more about what they're doing there, and they're very interested in learning what we're doing here in terms of community engagement. So that's just an example of how Polis Center, has, we are working beyond Indiana, but mainly when we work outside of Indiana, it is to share what we've been doing here and then to learn from others. Okay, so place matters. Place, all of the work that Polis Center does has a place element. That's one of the things that makes our work unique from some other centers and entities on campus and beyond. But we really believe that the power of place and geography is important for identifying and solving critical social, environmental, and economic issues. We hear this statement a lot these days, but the environment where you live, work, and play, that it impacts your health. And we've done multiple, collaborated with the Fairbanks School on multiple research efforts looking at life expectancy and looking at life expectancy across the city. And we definitely see disparities, and not only do we see disparities in life expectancy, but just where you grow up has a big influence on your entire life trajectory and turning, including what you ultimately earn and just your overall quality of life. So we're very interested and very active in collaborating across the university in helping to understand the context of whatever the problem at hand is, whether it's disparities in life expectancy or disparities in some other health outcome, or we work a lot with health researchers and public health researchers, but our work extends well beyond that. We're working with housing experts and transportation experts and folks from the criminal justice system, just across the board, and working with community stakeholders and helping to understand what's going on in the community. And many of those issues would be classified as social determinants of health. So we are very excited about bringing all of our data work and all of our analysis in those areas, along with our research collaborators, to the table as we collaborate with health researchers. And this is just an example of one of the analyses that we recently did, where just looking at and we tend to look at very more precise geographic levels. Here we're looking at how the census tract where you grew up influences what your ultimate household income is, or we can see that folks that may have started up with in the same level in the same lowest percentile of household income, that doesn't necessarily determine what your income exactly would be in the future, but it shows if you live in particular places across the city, across Indianapolis, you will have a greater likelihood of achieving greater household income. So it's this is just one example of the type of analysis we do, where we're using small area geography and using time series data, and just again using that spatial component. So we make data and research actionable by using information technology and geographically precise data, as I just mentioned, and across various domains and sectors. And most of our data is really focused on the community level, understanding communities, their challenges and opportunities. And so this is an example of one of our products. It's the Savvy Community Information System. You can see here that we are here. It's focusing on home ownership and housing cost burden, and we transform data that may not often is not spatial, but we transform the data into multiple geographic scales, such as the neighborhood level, the school corp level, county, council district. And our goal is to make this information readily explorable by researchers and students and community members. So we build a spatial data infrastructure. That's what allows us to take data and put it on a map, and it allows our spatial information infrastructure allows us to integrate data that wouldn't otherwise be integratable. So that's one of the powers of using geographic information systems. So we've spent the last 30 years building out and maintaining our spatial data infrastructure, including for geocoding of data. And we every evening we are geocoding all of the new records that come into the Indiana Network for Patient Care. And that in turn allows that clinical data to be integrated with these other community level data that Polis Center collects. So our contextual data, two of our primary, these are not our only sources, but our two primary portals into the rich data sources that Polis has are Savvy. We established Savvy back in 1996 as a community information system, and that is where you'll find the bulk of our data, again, at multiple different levels, related to the social determinants of health. And we've been continually expanding Savvy and the measures, community level measures that we've got in Savvy based off of our collaboration with folks like you, with researchers. And so the lovely thing about Savvy is that it is a community resource. There's some base funding that we get from Lilly Endowment and other funders to to originally to have built the Savvy information system and then to continue to maintain it. But every time we do a project with someone where we're envisioning and designing new measures that would be helpful for understanding the social determinants of health, it goes in there. And we're doing, as I'll get to later, we do are very involved in creating community engagement data portals. And those are most often project specific. So we're engaged with multiple community health improvement initiatives and even clinical studies. So we'll build dashboards so that the stakeholders of those particular projects will be able to focus on, exactly what they'd like. But obviously, we don't put any confidential or informative health data or anything like that into our community portals. But for all of the creative thinking and envisioning and designing that's gone around creating new measures to support different research questions, again, that's kind of our agreement. We'll build a dashboard for you off of Savvy, and it can be at a much lower price than it would be if you try to do something like that on your own. But what each project is giving back, again, is helping us expand Savvy for the whole community. So it's been a really nice model. And more recently, we have published the Encyclopedia of Indianapolis. Now that is actually a product now of the Indianapolis Marion County Public Library, but we're a partner in continuing to maintain that. And that is a wealth of really great information about communities in Indianapolis. It's based off of the Encyclopedia of Indianapolis, the big, thick book that we published back in the early 90s. But now it's digital and it's got interactive maps and just a lot more really engaging content. And it's been developed in close collaboration with community leaders and community stakeholders, and what are the stories that they would like to tell about their community. So if you haven't checked out the Encyclopedia of Indianapolis, I would encourage you to do so, because it can be helpful when you're reaching out to different neighborhoods or communities to kind of do your homework and understand, the history of the area that you're going to be hoping to engage. Again, a lot of domain-specific information. We've, education, housing, crime, and many other, really, when you think about the social determinants, we've got information across the board there. We also have information on relevant social assets. That's something that's really important when you're engaging with a community. Usually they don't want to just focus on what the problems are in the community, but they would like to put forward what the assets of their community are, and also have that be part of the discussion and understanding what and talking about what the issues that they'd like to address and what are potential solutions. So here's just a list of some of the data that we've got in our Savvy community information system. I mentioned some of these, but again, public safety, equity is from the very beginning in the mid-90s when we established Savvy. Our goal was always to stratify the data by race and ethnicity and gender and age where possible, because it's by stratifying those data that you can really dive down and it can help identify disparities and inequities. And so we had a great running start for all of the increased interest in understanding issues of equity, and we've since developed an equity dashboard specifically, kind of focused on that frame to help all the initiatives that are going on to understand issues of equity. But also education, and we do a lot of work in natural disaster mitigation planning. We work with counties all across Indiana, and so there's some very interesting data about natural disaster risk, as well as critical facilities. And that's an area where there's increased interest in looking at the population impact of natural disasters and the population health impact of natural disasters versus, originally it was focusing most on like building damage and economic impact, just from building damage. But that's another area where our work is expanding. So I'm mentioning all this just because I think it gives you an idea of some of the other data the types of data that we're collecting. Okay, supporting the health sector. So again, Pulse works across many different sectors, but we are very committed to working with the health sector. As early as 1998, we were going to the American Public Health Association conferences to talk about how a community information system can provide a wonderful resource for, at that time, we were talking about public health and population health. We were not talking about precision health at that time, but we've since engaged with partners here at Regenstrief and elsewhere in the School of Medicine to think about and support the use of our data, our expertise and our data resources for precision health. So, and I suspect most people in this room are familiar with the term precision health, but that's really where you're looking at that precise analysis of genetic, behavioral, and environmental factors that shape an individual's health. And so where we come in is providing the environmental, which are often our socioeconomic, sometimes physical environment, but also helping to integrate that community level data with the individual level that Regenstrief and others are the keepers of, the managers of. So precision health, population health, we've collaborated with folks across the school, including with some Regenstrief researchers on just understanding the distribution of health outcomes across and within groups of individuals. And then also lots of activity in the public health arena, including supporting our health system partners in doing their community health needs assessments, and also increasingly collaborating with clinical researchers, but who are interested in having it being a very community engaged research process. So in that area, in the community health area, a lot of it has been about how we can engage community stakeholders around available data and kind of create that common information landscape for our collaborators to base their conversations off and to kind of facilitate the conversations. Here's just a few examples of some of our clinical decision support type collaborations. Just over the last, I'd say 5 years, we have been involved in over 50 different clinical collaborations, and we're increasingly getting contacted by individual researchers interested in how they can access social determinant of health data, and also just understanding what are the options in terms of designing community measures that fit the individual's research question, and also talking about what is the appropriate geographic scale, and understanding the limitations of data that at the community level and at the different geographic levels, and just so we are experts at using at the technologies that are used for spatially enabling data, including clinical records, and then there are a lot of considerations in terms of what is most appropriate, like most appropriate level of aggregation, depending on your research question again. And we love having those conversations, and we are here to have those conversations. So if any of you have a research question in mind and are thinking about the influence of community level factors, we would be delighted to talk with you. And that's an area where we're building up our team, so we have more capacity to do that. But we also are very interested in not just being a partner that does things for our collaborators, but building the capacity of our collaborators to do that themselves. And so I think you'll see an increasing number of workshops, and we do a lot of savvy training workshops, but workshops that are focused more on particular subjects like social determinants of health, so that we can, we don't want to be the doers for everyone, but we want to build the capacity of folks to gain those important skills. So, and I kind of already covered this, but one of our big roles is adding value to data. So transforming raw data, whether it be administrative data or primary data that's been collected by us or our partners, but thinking about how to conceptualize and design meaningful and valid indicators that describe communities. And because of we've been collecting, we built the Savvy Community Information System almost 30 years ago, and we've been collecting data ever since. And so we have the ability to provide time series indicators for trend analysis. And we also have the ability, if the data's, there's some new data source that our partners have, whether it be a clinical data or some other kind of social determinant data, we can help create time series indicators that are comparable across time. There's a lot of thinking that goes into that too, and so we can help make sure that it's done in a way that retains the validity of any developed indicators, and then just generally spatially enabling data. And just I thought it might be helpful to include an example of some of the work we did. This was, we worked with Dr. Zayed from School of Medicine on a multiple myeloma survival analysis. And for that, we just had population data, level data. This isn't one where we use data from the INPC, but we got multiple myeloma incidence data and mortality rate data from the Indiana State Department of Health, as well as the Cancer Registry. And so Polis's role there was to figure out, okay, how can that data be mapped meaningfully? And we did hotspot analysis and looking, helping our research partners identify where there might be clusters, disease clusters. And then we also, for the later stage where they were interested in modeling the potential association between particular community level factors and these disease outcomes, we provided data across various topics, again, at the most meaningful geographic level. So things like just the demographics of the population, and socioeconomic information like income, poverty, education, marital status, structural indicators like segregation indices, and just as one example, and even though we don't consider ourselves the experts on environmental measures, we've got plenty of partners in that area, but we will work with our partners to identify, the right data, and then we can spatially enable it and pull it in, help a researcher pull that into their analyses. And let's see, how am I doing on time? Okay, I probably should wrap up in the next couple minutes, but just I think I've already alluded to the fact that in addition to working with individual researchers, and I think many of them do get referred to us by the Regenstrief data group, but we're also increasingly being contacted by folks elsewhere who've discovered or learned about us. So we do that type of work, but also we are regularly, increasingly invited into to these community-focused efforts. And so one example, which you guys may have heard about, is the Diabetes Intervention Project for Indianapolis neighborhoods, DIPIN, that's led by Dr. Lisa Staten in the Fairbanks School. So we have been working with Lisa and her research team and the community since 2017, and making data about the community readily accessible and usable for their community steering groups. We are now just finishing up, and by May we'll be doing beta testing for another community dashboard for the iHeart initiative that's being led by IU Health. That is advancing cardiovascular health equity through community partnerships. And Brownson Tucker Edmonds is the PI on that one. So it's going to be another, again, for each of these, we are using the SAPI infrastructure. So it's relatively easy, I'll say, for us to stand up these dashboards based off of our infrastructure, but then they're always designed in collaboration with the project leads and the stakeholders. We've recently completed a social determinants of health story map for the Marion County Public Health Department, and we're very exciting. Dr. Valerie Yeager, also from the Fairbanks School, has invited us in along with the IU Health, to help with them on the evaluation of the Indy Health District project, which is a project the IU Health is redesigning and their medical campus, but they didn't want to just focus on the medical campus, but then the whole neighborhood surrounding that campus, which is now being called the Indy Health District. And so it's really important to understand, where the community is at now in terms of like food access and community design, transportation, all that. So we are developing a dashboard for community engagement, and that will ultimately help in tracking progress over time. So we love doing these type of projects as well, and we're in the School of Informatics now, so we've got lots of great collaborators to help us continue to innovate in our approaches. And we also get requested to work on community health reports, which they almost all of them. There's a section that talks about health outcomes, but then the bigger role for the Polis is doing is helping to describe all the different social determinants of health. So, so the State of Aging and Central Report, if you're interested in the older adult population and the challenges, the population trends and the challenges they're facing, I would encourage you to just Google State of Aging and Central Indiana Report. We've got a whole website, and so this is an ongoing partnership. We're in our third phase, and in addition to creating this, now it's going to be a biannual report. We do regular, and actually for most of our projects, we do facilitate community seminars that highlight, one of the issues that's come out in the report, and talk about it in a little bit more detail and with community stakeholders at the table. And we've also just been asked to do a similar report, State of Women in Central Indiana report by the Women's Fund. So that is a very quick run through, a very high level. I would welcome any questions. I will say that if anyone's interested in learning more about the Polis Center, or even if you have an individual project in mind, or if there's an initiative you have, please feel free to reach out to me. I'd love to talk to you. Also, if you've got a question about, like say you're a graduate student, and you've got you're wondering about a particular data set, you can send an email to savvy@iu.org, and there's a whole team of folks who get those emails, and it facilitates it if you say community health and subject heading, because then that goes to the right team members. Because again, we've got folks that focus on different, like we've got housing experts, transportation experts. But if you put community health, that will signal where your request should to go to. But again, we're just, as I mentioned before, we're just doing our strategic planning now, but I think we are getting wonderful support from our new home and the Luddy School. I like to say, for the longest time, we've been a hidden gem, and now we're becoming a gem in the crown of our new school. So, we're very excited about the opportunities to partner with Regenstrief and all the great students and researchers. So I'll end there.
If anyone has any questions or comments, please go to one of the microphones and remember to turn them on. And if the online community has any questions, please put them in the chat. Thanks.
Thank you so much, Karen. So maybe a couple questions for you. One, I was curious about some of the data, particularly the Savvy data, and the timing of availability of that data. So there's often a lag with
Yes.
census data by a few years, and sometimes we need to know the information about a neighborhood or the place more immediately. So could you speak a little bit about the timing of the availability of data? And then the second question I have is around the cost of data for researchers on campus.
Okay, great.
Thanks.
Yeah, so we do, yeah, there is a lag and when data gets to from the source provider to Savvy, we update Savvy every quarter, but not every data set. So yes, you will see some lags. Now, everything that you see on the Polis website it is for free, and you can download those data. You can download them at different geographical levels when you're talking about the aggregated data. So looking at the at this, and it's Savvy, as I say here, savvy.org is the website. And if you go to tools, there's a whole set of tools there. There's community profiles where you can create a profile for a community based off of whatever census tracts or whatever you've selected. You can do things where you're looking at a population profile. So if you want to learn all about like the older adult population or the youth population. So we've tried to package data in a way that allows easy browsing. But I think for researchers, the best way of using those tools is to get an idea of what we've got. But it never stops there. I mean, we work with our community stakeholders to decide what's the priority to put up there. But there's a lot more data that we've got in-house, and also we can normalize it, or we can transform the data often as needed to meet the needs of a particular research question and study. So yeah, I would just again use that as a place to understand generally, and then contact us when you've got your research question, or even when you're designing it, because you want to know what the kind of the possibilities are, and we would love to brainstorm with you. I mean, that we love doing that. So and I say, so I'm getting around to the answer to the question that even with census data, yes, there's a lag, and you could go straight to the Census Bureau site to get more current data. Well, we'd be happy to work with you to do that, because our folks are using that data all the time, and they just it's very easy for them to do. So yes, there is a lag, but we can work around that if there's an initiative. Now, when we are working with folks from the School of Medicine, most often there'll be a junior researcher, like someone starting out in their career, and they'll have an advisor with more experience. But so we will help them have all the conversations and help them explore. But once they decide, okay, if they want us to geocode their data, if they want us to link things, we need to just charge for the time. So we're never charging for data. We're only charging for our staff time. And we've got a growing number of folks. If any of you have worked with Polis before, you probably know Jay Colbert. He's our data manager, but he's also a senior GIS analyst. And so he has the most experience in interfacing it to actually do the work of providing folks the data sets they need. But we are increasing that staff, including bringing on individuals who have doctoral degrees in related, like social determinants, health related fields, who also can help. Think again, it's thinking about the research question and what that matches. So there is a cost though for anything, not for talking with us, but for any time that we need to, And I think there was another question. I can't.
I think you got it. Most of it was so cost, and then the other one was just curious about the timing of the data and the lag. But maybe a slight, which I think you answered.
Yeah.
Slight follow-up question of if you have data that you want more timely data on for the city of Indianapolis or the state, is there anything that you're using? You're using some of this data beyond just census data that you
Oh yes,
that you have more timely data. Can you talk a little bit about that?
Yeah. Okay. So beyond sense. So are you looking for what other data sets we might have that are more other than?
Timely.
Yeah.
Current.
Um, well, a great example probably would be our for anyone who's interested in housing and evictions and the evictions as one, a social determinant of health. We just finished developing the first and only statewide evictions dashboard. So I mean, it has the latest available evictions data.
Got it.
So that's an example of where we're doing all these other projects.
Got it.
And you won't, I mean, if you look at all across the Polis website, you can learn about these things, but that's one of the things that I think will come out of our strategic planning is how can we be better at allowing our colleagues on campus to know what we've got.
Yes. Okay.
Yeah,
That's
but
great. Super
that's why, but please call us because and
Yeah.
let us know what you're interested in, because I think that's still the very best way. Yeah.
Great. Thank you so much. Any other questions? I know you have
yeah,
to.
I have a comment
Yeah,
from
one.
online real quick. This is from Cynthia Lumberg. I would like to ask about the research you are analyzing, where you're obtaining it from where. I understand there are SDOH surveys being created and mapped to LOINC. Are you tapping into the Gravity Group to support your data analyzation?
I'm familiar with the Gravity group, but we're not actively engaged with them. But that, I mean, that's something that I mean, if you've got suggestions on what we need to do to be more relevant for you guys, we would love those. So,
I'll make sure you are put in contact.
okay.
Yeah, I think that kind of gets at just the importance of data standardization with a lot of the metrics that we use. And I think a lot of what you have in here, they're standardized and defined, but there's, I think, a lot of domains that aren't. So I think our health data standards team is working on that. So
Okay.
it might be a good follow-up conversation.
Oh, yeah, that sounds great. That
But
sounds great.
I know you need to run, and
know.
I want to thank you so much. And yeah, a round of applause for coming. Thank you.
For having me.
And lunch is served, so definitely get some food on your way out.
Thank you.
Thank
again.
you.
This is just the beginning.
Yes, definitely. Thank you again.